Hi everyone, I'm Eunhwa Yang from the School of Building Construction, and I have team Erdogmus, Jennifer DuBose from SimTigrate Design Lab in the College of Design, and also Hong Ya from Mechanical and Biomedical Engineering, and Arthi from City and Regional Planning. So, we're trying to study the relationship between the built environment, the especially ambient environment of homes, and older adults who are experiencing mild cognitive impairment and their sleep health. So MCI, mild cognitive impairment, is in between healthy normal aging, cognitive aging, and Alzheimer's and dementia, that extreme cognitive decline. So about 15 to 20% of people who are 65 and up in America experience MCI. And about a third of them actually advance to Alzheimer's disease or related dementia in 5 years. So it's quite a long journey. And so we collaborate. We actually work part of the team. We're part of the team of Cognitive Empowerment Program that is with Emory Alzheimer's Research Center. And with that program, so we wanted to compare, the first phase, wanted to compare the affluent group who are, recruited through the Emory, memory clinics, usually have care partners living together, and most of them are homeowners in higher education and up. And we recruited people from Grady Memorial Hospital here down in Atlanta, and mostly low-income communities, and we wanted to see how their environmental, how much of satisfaction they would have environmentally. And also in the second phase, we actually went out to some of their homes and installed the sensors and also did the interview. So that was the part of the phase 1 and 2 survey and interviews and site visits. So there is a strong evidence in the literature that says sleep disparities among socioeconomically disadvantaged groups. And what we found, so we published one paper comparing affluent and low-income communities and their sleep health and how. So what we found was home ownership matters, even for sleep health. And also depression, anxiety levels were higher in the low-income communities. And our sample from low-income communities are mostly renters and living alone with MCI. And so we combined these in-situ measurement data of temperature, relative humidity, sound and light. And what we found is that people perceived. So this is pretty, eye-opening for me personally, and also our team. That when we just ask, okay, are you comfortable with your bedroom temperature at night? No matter whoever you ask, they'll say, I'm okay. We're asking average 69 years old, experiencing MCI. They tend not to, complain or, about their situation. So we had to actually, unfold in an interview and in situ measurement. So 3 things were significant findings. So temperature mattered, noise level was above the suggested levels for low-income communities, and also lighting levels were pretty dark. It depends. Yeah. But during the daytime, they were exposed to probably 30% less than 30% of the level of suggested lighting level. So that would also affect the circadian rhythm. So we're developing community outreach modules that would also educate and recruit people. as a participant. So we're, constantly keep continuing collecting data and also finding fundings and applied, rejected, revising those things. Thank you.